Okay, so this section, part 3, welcome back. We're going to talk about the diagnostic and care of the patient, including management and nutrition. And then we're going to jump into the next slide, which is going to be the oral agents that we're going to use to treat diabetes. So when we're talking about diagnostics, we need to typically figure out if they have diabetes or not. And the biggest way to do that is through lab tests. So I've listed a few diagnostic tests that you can find in your nursing references. And most commonly, we use the hemoglobin A1C. What's cool about the hemoglobin A1C is it is the percentage of hemoglobin that has glucose attached to it. And the red blood cell has about a lifespan of about 120 days. So typically around the 2 to 3 month period. And this is the life that the glucose is attached to the red blood cell. So they measure that. And there's a percentage. And now anybody with red blood cell issues, there could be an issue with measuring the hemoglobin A1C. But typically it needs to be less than 6.5%. So anything greater than 6.5%, that means there has been a large amount of glucose attached to that red blood cell. And typically they'll diagnose you with having diabetes from the hemoglobin A1C. Now, there is additional testing, of course, if you're measuring your fasting glucose, which is the not eating, being NPO for at least 8 hours. If your blood sugar is greater than 126 milligrams per deciliter, then they will typically send you for more testing, including a hemoglobin A1C. So if you have a fasting glucose greater than 126, typically you have too much circulating glucose in your system. And they also could do an oral glucose tolerance test. This is where you go into the hospital or into your doctor's office and you drink a very sugary drink, and over time they check your labs. And anything greater than 200 means that you did not have enough insulin, or there was a problem with the receptor sites of the cells to move the glucose into the cell, and you were over 200. So typically they'll use that with the signs and symptoms being present to do the random glucose level greater than 200. So those are typically a few tests to diagnose diabetes. Now, diabetes management and interprofessional care, we're going to go from the least invasive first, if that is possible. If you're not type 1. If you're type 1, we're going to go straight to insulin because you need insulin for life. So you're going to have an injectable insulin, and we'll get into the types of insulins in the next chapter. So this one is they're going to try to maintain you with the blood glucose. Again, refer to your references or your nursing resources or facility for your glucose maintenance level. So here I'm going to talk about 70 to 110. Education, of course, how to use a diabetic monitor with the glucometer, how to use the medications and the types of medications we're going to get to in a minute, and nutrition. So if you can actually maintain a normal weight, lose weight, and or have good nutrition, typically you can keep your blood glucose in range and not have to add medicine on. So they'll try to start with lifestyle modifications and diet first. Now, if that doesn't help, then they have to move on to oral medications and or additional medications. So good daily nutrition plan typically for these patients is around 45% carbs, which about 15 to 20% of proteins. We're going to watch our kidney function. Again, some of these medications like metformin we're going to talk about can affect your kidney function levels. So too much protein, which is the buildup of your BUN and creatinine levels, we'll talk about that, is it can cause increased kidney function problems and lead to either AKI or chronic kidney disease. So we're going to watch our lab levels and BUN and creatinine. And about 20 to 35% of unsaturated fats is important. We want to stay away from the saturated fats, again, because we talked about that metabolic syndrome leading into people with coronary artery disease and other problems can lead into diabetes. So we want those unsaturated fats. Okay, now we're going to move into the oral agents. Now, if lifestyle modifications and diet and exercise did not help, they will typically start with an oral agent. The first line drug, most typical drug that you see on the market that most patients are on is metformin. This one can come in different types. There is immediate release, extended release, liquid form. I've listed a few here, but this is the first line treatment for type 2 diabetes. And what it does, the action is it decreases the glucose production from the liver, and it also helps transport blood glucose into that cell. So it helps that receptor site move the glucose into the cell. Now, it does have some additional benefits because we talked about that metabolic syndrome with the high cholesterol and the low HDL levels. It actually lowers the plasma lipids. So it has that additional benefit. Now, some really important things to know about metformin is the adverse side effects. So one of the things we talked about is that it can cause some kidney or liver problems, and it can produce lactic acidosis. So these people typically yearly have a CMP or a BMP run, so they could check to make sure that their kidney functions are fine, and they may have LFTs also checked. Now, any GI issues, it can cause a little nausea and vomiting and increase gas pains. So typically this medication runs around 1,000 milligrams, and that is a typical dose for metformin, and it's typically twice a day, BID. Now, it's very important to take this with food to decrease those GI issues, and a lot of people do need supplements of B12 and folic acid. Now, I'm going to go ahead and talk about the important circle area right here about holding metformin. Now, if you do have a surgical or a radiology procedure that you know of that you're going to be receiving contrast medium, you're instructed to discontinue that metformin before, and then you're going to hold it at least 48 hours afterwards, because the contrast medium contains iodine and can cause AKI, acute kidney injury. Now, for those that go into the hospital or into the emergency room and realize that they have to go and get a CT with contrast and they can't hold it, it's very important that they will typically give them a lot of fluids to flush their kidneys, and they'll still hold it at least 48 hours afterwards and check their BUN and creatinine to make sure that their kidney functions okay before they resume the metformin. So really important educational piece that you need to know about. And that concludes the oral agents. We're going to next move into, in the next segment, the insulins and how they work. So I'll see you in that lecture. And follow me for more nursing tips.